good presentation to you shortly. But first, let me tell you a little bit about PBNSG for those of you that are new members or you're watching the replay and you might not be that familiar. PBNSG stands for Plant-Based Nutrition Support Group, which is a nonprofit organization dedicated to educating individuals to the benefits of whole food plant-based diet and lifestyle in order to prevent and reverse their chronic diseases. So in addition to the talks like we're having tonight, the presentations, we do have an amazing team of specialized hosts who each lead their own monthly support group here. So if you're not familiar with that, I encourage you to check it out. There's a big variety of groups. I think we have 11 or 12 typically, up to 14 sometimes. And there's a group for heart disease or diabetes or cooking for beginners or pain management. So there's topics for just about everybody. I happen to lead the inflammation support group on the first Tuesday of every month, and I'd love to have you join me there as well. Just keep your eye out on your emails. You get notified of all these groups pretty much as they happen. So another way that you can take advantage of the membership platform here is with the free community support group, which is on the second Thursday of every month. And that's a really good way to meet other people. And again, my name is Sid Notter. I'm a longtime nutrition educator and the author of the Plan A Diet. And I've been teaching whole food plant-based for over 25 years now. And I would love to have you, as I said, come to my inflammation support group and let me get to know you a little better too. So welcome to Victoria and Rebecca. Thank you guys for being here. Upcoming events. So next Thursday, May 23rd, Dr. Vivian Polak, will be here. And I think she's doing part of a series. Her last talk on here was fantastic. So try to join in on that if you can. Tuesday, May 28th will be the member meetup group. And on Thursday, May 30th, Dr. Lakshman Malpuri will be here. And I hope I'm pronouncing that right. And he's been here before too. So be sure you tune in for that if you can. So now it is my pleasure to introduce you to tonight's speaker. And thank you for being here, Dr. Kim. Dr. Kim Scheuer began her career as a traditional family practice physician. And despite eating healthier than most Americans and thinking that she was fit, she struggled with weight issues until the age of 47. And then while she was searching for a way to decrease her family history of cancer risk, Kim read the China study, and what she learned started a long and fruitful journey of discovering how to use a whole food plant-based diet and lifestyle medicine to prevent, treat, and reverse chronic diseases. For the first time in her career, she could genuinely help herself and other patients heal rather than merely treat the symptoms of illness. On her journey, Dr. Scheuer transitioned from the traditional medical group that she ran and worked in for 20 years in Aspen, Colorado, to her lifestyle medicine practice, Doc's Lifestyle Medicine. She was then privileged to join Love Life Telehealth, which was formerly known as plant-based telehealth, and she's thrilled to help others there improve their health through lifestyle change. Kim lives and benefits from the lifestyle she recommends for her patients, and she enjoys de-prescribing medications and helping patients feel younger every year by adopting healthier lifestyle choices, just as she has done. Dr. Kim is board certified in both family practice and lifestyle medicine and is licensed in 23 states. She's conversant in Spanish and American Sign Language as well, which she uses to bring her knowledge to multiple communities. So as we go along, if you have any questions for Dr. Kim as she's doing her presentation, please type those in the chat and we'll have a Q&A session at the end. So thank you, Dr. Kim, for being here tonight.
Thank you guys so much. I really appreciate it. I am going to get to my lecture. So I'm a good doctor, but not great with technology. So let me see if this will work. Give me 1 second. Okay, yay. All right. I hope everybody can see this. So as was mentioned, I am board certified in both lifestyle medicine and family practice. But we're going to talk about colorectal cancer and lifestyle medicine and what we can do. So colorectal cancer is, unfortunately, the third most common cancer worldwide. It accounts for about 10% of all cancer cases. It is the leading cause of cancer-related deaths worldwide. And it's becoming more and more prevalent and younger. The American Cancer Society stated in 2023 that the number of young adults less than 55 years old diagnosed with colorectal cancer is nearly doubling compared to a decade ago, and the rates of deaths are increasing. And risk factors increase with unhealthy lifestyle choices. So the risk factors are a diet high in processed meats, low in fruits and vegetables, a sedentary behavior, obesity, smoking, and excessive alcohol consumption. It used to be that the cancer screening guidelines for colorectal cancer were 50 and above. Now, actually, they really want it to be 40 and above, but because of cost and things like that, it's now 45 to 75. Colorectal cancer screening every 10 years for average risk patients. So if you are above average, so for example, a family member, a first degree family member, sibling, parent, had colorectal cancer at age, say 60 or 50, you would start 10 years earlier. Okay, so that would be at 40. And then after you get to 75, after 75 years old, it's selective testing based on individual factors such as overall health, life expectancy, et cetera. If you're going to expect it to live another 10 years, definitely get cancer screening for colorectal cancer. And there's a bunch of different ways to do colorectal cancer. One is something called fecal occult blood test, which is you use your finger and check. Well, you use your finger to check to see if there's any rectal masses, but also a test where you can just put some poop on a piece of paper and it checks for blood. There's that you do every year, or a DNA fit test, which is every 1 to 3 years, mostly 3 years, where you poop into a big thing called and it's called Cologuard, where you poop in and they check for actual cancer cells. There's CT colonography every 5 years, flexible SIG every 3 to 5 years, flex SIG every 10 years, but the Cologuard or other tests much faster, and then colonoscopy every 10 years. And there's risks and benefits for all kinds of screening. Checking for blood only checks for blood, and you don't always have blood going. Checking for the cancer cells is a little bit more accurate. Doing a CT colonography, which is where you have to still clean out people don't want to do the whole colonoscopy where you have to clean out your whole body. You swallow a camera basically and it looks through, but you still have to do the clean out. Flex SIG can be done in an office. So there's a lot of different reasons to do one versus the other. What did I do? Oh, there it is. I went the wrong thing. So lifestyle medicine, I forgot to put the slide in. I put it in later and I should have put it the first one. But what is lifestyle medicine and how do we use that? So lifestyle medicine is a evidence-based practice that uses 6 areas to prevent, reverse, and treat chronic diseases. So 80% of what we see in our offices are chronic diseases, and they're caused by lifestyle. And as you remember, when I was talking about this, that risk factors for colorectal cancer are diet, sedentary behavior, obesity and smoking, and excessive alcohol consumption. That's 5 of the 6 areas of lifestyle medicine. So lifestyle medicine looks at improving a nutritional diet, increasing physical activity, managing stress, improving your sleep to get restorative sleep, having good relationships, and avoiding risky substances. And they've proven that actually reduces or can reverse, in a lot of cases, 80% of what I used to see in my practice, which is chronic disease, which is heart disease, obesity, hypertension, diabetes, type 2 diabetes, et cetera. So we're going to talk about how we use lifestyle medicine in colorectal cancer. So again, some of the references I put down below show that processed and red meats have long been associated with colorectal cancer, and it's a dose-related thing. The longer and the more processed red meats you have, for example, bacon, is the more likely you will have colorectal cancer. And colorectal cancer is anything from the rectum all the way up into the intestines. Systemic reviews showed that lifestyle interventions on diet and weight are feasible for treating for patients with colorectal cancer. So it's important to prevent it, but it's also used for treating. You can treat if you've been diagnosed with colorectal cancer before you even start treatment, chemotherapy, radiation, or surgery. You can start treating with lifestyle changes. And then during treatment, and then even after treatment, they show benefit. And the focus should be on whole grains, vegetables, whole fruits, plant proteins, and I mean not isolated plant proteins, but in food, and healthy fats. Avoiding high glycemic diets. So glycemic diets are ones that are high in sugars that can be absorbed very fast. So, that's like sodas, things like that would be a very high glycemic diet. And cancers tend to feed on sugars. So you don't want that. So you've got to avoid high glycemic diets and refined carbohydrates when you are using diet in the role of dealing with colon cancer, or colorectal cancer. So exercise is a second pillar. There's plenty of research on exercise and cancers in general, but also in colorectal cancer. So breast cancers, if you exercise regularly, it decreases your risk of breast cancers and decreases your risk of death from breast cancer if you've been diagnosed with it. Exactly the same with the foods. So the systemic review found that lifestyle interventions involving exercise are feasible, again, in people with colorectal cancer if you're diagnosed before treatment, during treatment, and after treatment. And there is a thing called exercise-induced metabolic shield. So they found that if you've been diagnosed with colorectal cancer and you exercise, it actually changes the way sugars are uploaded into the cancer cells, and it blocks that. So it blocks metastases. And so really important that you are physically active throughout if you have been diagnosed with colon cancer, because there is that metabolic shield, which can help block cancer progression and metastases, which is the biggest thing. You don't, if you have cancer in one place, you don't want it going around your body. Strengthening, aerobics, all are suggested in every part of the disease stage. Avoiding toxins is huge in colorectal cancer. We all know that smoking is associated with lung cancer, but they've also found that there is increased mortality from colorectal cancer in smokers, not just lung cancer, but also colorectal cancer. So increased risk of death, increases it, the risk of getting it 60%, but then you also increase the risk of dying from it. And alcohol, everybody asks me about alcohol. Well, isn't one glass of alcohol okay? Any alcohol is associated with cancer risk per the World Health Organization. But in terms of colorectal cancer, there's significantly increased risk of colorectal cancer in drinkers versus non-drinkers. And interesting, beer and spirits have more risk than wine, but there's still significant risk with wine. So some people say, well, I can still have my glass of red wine. Yeah, you're lowering the risk, but there's still a risk. And it's dose response. So the more you have, the worse likelihood you might have of having colorectal cancer or dying from it. And they think it's possibly due to the carcinogenic contaminants like nitrosamines and acetaldehyde in the alcohol, which are known carcinogens. Sleep. So we're going to the next pillar of lifestyle medicine. There's several studies that show an association of shorter sleep duration along with longer sleep duration combined with snoring and obesity increase colorectal cancer risk. So people say that you should, the studies show that you should sleep most likely between 7 to 9 hours, not less, not more. So people who sleep 12 hours a day have an increased risk. People who sleep less than 7 hours can have increased risks. And I don't know the mechanism, whether it has to do with the obesity issue, because if you don't sleep well, you're more likely to be obese. But and obesity in itself has a risk factor for cancers, especially colorectal. But they've shown in studies that sleep disorders and depression have a synergistic effect on colon cancer incidence. So it's important to address both. You want to address both of those before diagnosis and also if you are diagnosed. Stress management is also an issue in cancers, but in colorectal cancer, there's studies that show that perceived stress was strongly associated with rectal cancer. More studies are needed, but it's interesting because you look at people who have a lot of stress in their life. If they don't perceive that it's a very damaging thing, they have less risk than those who have stress, but they perceive the stress and they handle it differently. And since stress affects how we eat and how we sleep, and everything in lifestyle medicine is interconnected, dealing with stress and using appropriate stress management techniques will help lower our overall morbidity and mortality for many medical diseases, including cancer. And then there's social connectedness. And people don't think that stress or social connectedness really make a difference in our health. But there are many studies out there, like the Nurses' Health Study, that show that people who are socially integrated, that have good friends, that have good support services, they have less what's called all-cause mortality than those who don't. So that's death from heart disease, strokes, hypertension, cancers, et cetera. And specifically, colorectal cancer was looked at in the Nurses' Health Study, probably because there are lower pro-inflammatory markers like IL-6 in people who have more social connectedness. Having a reason to live, having a sense of purpose, having somebody to caregive for you or you caregive of is beneficial. So it's important to not feel alone, and loneliness, especially after COVID, really hit our society very hard. So it really is, you'll see a lot of people in cancer treatment centers that really emphasize social connectedness to try and to improve survival. There are a lot of good resources out there if you get diagnosed with colorectal cancer. So things like the National Comprehensive Cancer Network has guidelines for patients and providers on all different kinds of cancers. Very, very helpful, especially the one for the patients. It has, there's an 80-page resource on just rectal cancer alone for patients who have it. And it has things from what is it, what to expect from it, what you can expect from treatment, how to talk to your doctors about it, what questions to ask. It's very helpful. There's books that you can read if you know anybody, and we all know somebody who's had some kind of cancer. So there's books to read, including Stop Feeding Your Cancer by Dr. John Kelly, Radical Remission, which gives people hope. There's Life Over Cancer by Dr. Keith Block. So there's Dr. Greger's book, How Not to Die, has a lot. They have a chapter on GI cancers. So there's a lot of good resources out there. There are resources out there, including now there's called ERAS protocols. So there's enhanced recovery after surgery, because if you have colorectal cancer, you need to get that cancer out and there's surgery. And so how do we improve recovery after surgery? And that would include before surgery, what you eat, how what you eat just after surgery, how you hydrate. There's a great cancer center called the Block Center. And it was written, this is by the guy, Dr. Keith, who wrote Life Over Cancer. And he is a traditional oncologist, but they incorporate all aspects of lifestyle medicine into their treatment of patients. Because a lot of places don't know this information. A lot of doctors don't know this. So if you know of anybody who needs a second opinion, Dr. Clapper, who is a colleague of mine, turned me on to this, and I've sent some patients there, and I've had amazing responses from my patients on it. There's something called a Signatera test if you have colorectal cancer that tests DNA in the blood after you've been treated to make sure that the levels are down, that it doesn't go back up again, because you worry if it goes up, if there is metastases or recurrence. There's things that you can talk to your doctor or your nutritionist about in terms of food. There's things like medical nutrition alternatives to Ensure, which Ensure is, as many of you know, is it's a replacement system if you can't eat, or if you're going through chemo and radiation and you don't feel like you can eat, and it just gives you some extra nutrition. But Ensure is full of junk, and it's just not healthy. So Kate Farms has an alternative. So there are resources for people who are going through colorectal cancer treatment to help them figure out how to navigate and be as healthy as they can. So this is just the NCCN guidelines. This is just an example of what it has. So it has the basics of treatment planning, the overview. What if you have non-metastatic cancer, if you have metastatic cancer, survivorship is really important, because once you go through treatment, actually surviving it is hard, because you have to fight through treatment, but then you get to the place where, okay, now I need to get back on with my regular life, but I'm still worried about this recurring. So how do you deal with that psychologically? What kind of follow-up do you need? Things like that. So it's really, I found this was extremely helpful for my patients. And it's not just for rectal cancer. They have it for all cancers. And you can even do things. I would highly suggest, if somebody is diagnosed or knows somebody who's diagnosed, that they talk to a physician who knows lifestyle medicine, because there's things you can do to help yourself while going through traditional treatment. For example, in prep for chemo, there's a lot of studies on fasting that while you're going through chemo, like fasting mimicking diets or fasting, that fasting causes your regular cells to stop, to slow down, to clean itself out, but it doesn't keep replicating, doing things, but cancer cells will. And so if you fast before chemo, you're going to shut down your normal cells. The cancer cells will still go and take up the chemo, and the normal cells won't as much. And so you have less side effects. And there's a lot of protocols for it. There's lots of studies on fasting mimicking or just fasting. But you need to have somebody who knows this, that can help you prevent some of the side effects and augment the chemotherapy effects without the side effects. Again, we talked a little bit about ERAS protocol before, and what foods you eat before and after surgery and how to do that. And it does help to get a good dietitian or nutritionist consult, but especially one who knows plant-based medicine. And then make sure you have an integrative approach. And like I said, the Block Center uses conventional therapy because, if you've got cancer, it's a big deal, and you need to consider all ways of dealing with it. But they also work on lifestyle medicine, the 6 pillars. They work on the biology, dealing with all the things that they're going to go through when they're going through chemo and radiation, like oxidative stress, immune dysregulation. They address treatment toxicities and circadian disruptions, and then they are very good about addressing survivorship and continuing lifestyle changes after treatment. Other places can do this. This is just one that I know specifically pays attention to an integrative approach, and you should have an integrative approach in dealing with cancer. And life after treatment, we talked a little bit about this, that health promoting lifestyles actually help survivors last longer, survive better. The prognosis is better. The quality of life is better. And so there's studies that show that not only health promoting lifestyles before prevent colorectal cancer, during treatment help improve your outcomes, but even after, it's really important to keep up those lifestyle changes. And other considerations that I think are really important are, how do you make sure you have active surveillance afterwards? How do you deal with physical expectations of changes in your body? How do you deal with psychological changes, including scan phobia? Because after treatment, you're going to have to go in and get blood work and scans, and dealing with the psychological stress of that, which can make things better or worse, is important. Using lifestyle medicine for long-term healing, and then dealing with partner challenges, because cancer doesn't just affect the person who gets it, it's the partners. And so make sure that you are dealing with all these considerations, and lifestyle medicine does help that, because it can help the partners too. And also it's easier to make lifestyle changes if the partners make changes and are involved. So for people who, are worried about colorectal cancer, have been diagnosed with or afterwards, you do want a good doctor who knows that. I work for Love Life Telehealth, and we have all these doctors who live the lifestyle. We're all lifestyle medicine boarded. We're all double boarded, mostly family practice, but we have emergency medicine. All have our own strengths and weaknesses. We're in nationally around this country. We do telemedicine, but we've had experience with people with cancer, and we also live the lifestyle we prescribe to our patients, which I think is really important. So this is just pictures of me living the lifestyle I prescribe to my patients, including, relationships that we talked about, avoiding toxins, good nutrition, stress reduction, and having adequate restorative sleep. So if you have any questions, we'll talk about questions now, but this is information about me and how you can find me, and we'll include that in the notes. So I'm going to end this now and answer questions if anybody has any. I kind of went fast, I apologize. But if anybody has questions, please let me know.
Yeah, I don't see any questions in the chat just yet, Dr. Kim. I had a few though. When you talked about exercise, I like that metabolic shield term. I just love that. And so, how much exercise do we need to do in order to prevent cancer?
That's a great question. So technically, the guidelines are 75 to 150 minutes per week of pretty strong exercise to the point of you can't talk while you're doing it, and so pretty good exercise, or 150 to 300 of moderate exercise, minutes of moderate exercise. That's more aerobic, and to be honest, any exercise you do is important. So anything you will do is important, but it is really, those are the guidelines for that. I also want to add that you should be doing strength training and resistance exercise, because getting your muscles strong is really important. So I'd say 2 to 3 days a week of resistance training for about a half an hour is also important. For me, every day is great. Take a rest day where you're not doing so much. But if you're getting out into nature, which is really important because the infrared, the sun exposure makes a huge difference on healing. They've done studies in hospitals where if they put people who are quite sick outside or have light exposure, they actually do better. So I'm the kind of person who is a multitasker. So I have my dogs, which de-stress me. I go out and walk them several times a day. So I'm getting in the sun, I'm getting into nature, I'm de-stressing, and I'm walking my dogs at the same time. That's a perfect exercise for me. Or, or strength training. I hate strength training. I hate resistance training. We need to do it. I hate it. So I multitask by walking to my neighbor's house, pick her up, walk to the other neighbor's house with my dogs. She has a little gym. We do our exercises together. So I'm doing social. I'm having the social relationship together with my exercise, with taking care of my dogs, with being outside, so that's the way I would do it. But to be honest, any exercise you do, the other thing is have fun. Like, for example, I have, as I've gotten older, decided to try jump roping again. So getting out of breath once a day for 10 minutes is really helpful if it's okay with your doctor. So I just started skipping and it's like so much fun. So have fun, do something like dancing or, something that you would really like to do. And then as we get older, balance balance is really important. So do that. So like when I'm brushing my teeth, I'll pick up my feet, my one feet, not both. I'll go on one foot and I'll brush my teeth to help my balance. And then I'll switch my hands. And then once I got used to that, I close my eyes. And be careful, you don't want to fall, but there's ways to do, add in things to what you're already doing. Or for example, I hate doing push-ups, but I started doing push-ups every time I brush my teeth. And I started at one push-up every time I brush my teeth. Now I'm up to 20 push-ups every time I brush my teeth. And so connecting it to something you already do is also a good way to get exercise in. I hope that
Interesting.
answers
Oh,
your question.
it did. Yes, thank you. So there's a question here in the chat. I have a friend with breast cancer now, and she just started chemo for prevention. She said her doctor said to stay away from foods with acidity. Is that true? I would like to get her juices, but most have citrus in it.
So that's an interesting, I'm not sure exactly what her doctor said. We do want to try and not acidify our diet. We want to have a more basic diet, but having healthy foods is less acidic in our bodies. And so juices are great if you really need them, but I actually would prefer you to have smoothies because you can have the fiber in it. If you can't take whole foods, which is the better way to go. So the best is to eat whole foods, and fruits, even citrus fruits, are not a problem unless you're having chemotherapy issues with sores in your mouth. That can be a reason not to have like an orange and to go for a less acidic fruit if you're having mouth sores. But eating a whole food plant-based diet is a less acidic diet than eating the standard American diet. And I would not worry about healthy foods in that person unless there's a specific reason and it's not acidic, it's not the
Yeah,
acidic. We do have Dr. Robert Brakey here, and I might ask him if he has any suggestions because he's amazing.
Thank you. Thank you. Great talk, by the way. I appreciate you so much. Come back to a little bit my question after, but the acid-base balance is a critical one. And so many people think of things like vinegar and vitamin C, ascorbic acid as acid, and they are, but they're a very weak acid. The potent acid, if you remember from chemistry, is hydrochloric and sulfuric acid. And sulfuric acid comes from the sulfur-containing amino acids most prevalent in animal protein. So if you look at the acid load to the body, fish, chicken, and pork are the worst. And in contrast, fruits, vegetables, and beans are alkaline. So the higher the animal protein, the more the cysteine and methionine, which are sulfur-containing amino acids, metabolize to sulfuric acid, and the greater the acid load on the kidneys. Um, this is only part of the reason, though, which I'm sure you talked some about, that animal protein can trigger or support cancer. So uh, the your friend's doctor is right, but I'm not sure they got it down to the right way of thinking of it, because you're right. Most people would think, oh, I shouldn't have any oranges then because they're acidic. No, go wild with oranges. Those actually have an alkaline kind of response in the body, as do other fruits. So, yes, thank you. Good question.
So this reiterates my statement of you need to have a physician who knows this, who understands this. So Dr. Brake is an example of an absolutely perfect person to have help you get through chemotherapy, radiation, or a diagnosis or prevention. So, and I don't know exactly how to reach you, but feel free to look him up because he's amazing too. So that's exactly why you should have this kind of information, this kind of person in your back pocket helping you out through this or helping family members out. Dr.
Thank
Brake,
you.
did you have another question?
We
Yeah,
have an
it's tomorrow I'm presenting to our colorectal specialty subgroup at our hospital about they have an enhanced recovery program, and they focus on how are we going to support our patients with colorectal disease, not just cancer, but also diverticulitis, Crohn's, others, in getting better pre, during, and post surgery. And as you know, one of the kind of standard dogma in surgery is you need lots of protein perioperatively to help heal. And I wonder if you see any data on this I might be able to share, because we all know protein is overrated. And what's more important is not how much, but what type of protein. Is it pro-inflammatory, signaling TOR, or IGF-1, or and interleukin 6, or is it ones like the plant proteins that are non-inflammatory? But I don't know, that's my kind of basis for it. But I wonder if you've seen these studies, because they're so attached to this. You need 1.2 to even 2 grams per kilogram during surgery. And the only way to get that is often fish, chicken, seafood. And as we just talked about, those are pro-inflammatory, fiber devoid. Anyway, what do you know?
So, I mean, when I was looking at this, is a great question and a great point. When I was looking at the ERAS protocol, they actually have studies in there that are plant-based. So if you get that out and you can look at that, what they do, unfortunately, is I think a lot of times they supplement with pea proteins, with protein isolates, which I don't think are healthy. So that's a real problem. So I don't, to be honest, off the top of my head, I don't have those studies for you that look at that. I know Dr. Greger has looked at a bunch of those studies. And he may have some on that he may know of specifically, because he is very, you shouldn't be having more than 0.8 grams per kilogram.
Yeah,
But
maximum.
the difference is, which is interesting to me, and I'm not sure, I haven't been able to ask him this yet.
Are you guys hearing the feedback?
Yeah, I
Yeah,
don't.
I'm not sure.
Okay, that's better. Yeah, so I find it interesting that they're talking about grams per kilogram when, like, my protein intake is probably about 15% of my body, 15% of my calories per day, yet I get 1.7 grams per kilogram eating a plant-based diet without supplementing. And so, because I eat a lot, because I exercise so much. So I don't know if there's any studies that would deal with the percentage versus the grams per kilogram. And, obviously a lot of people don't think it's grams per kilogram of ideal body weight. They think of grams per kilogram of their, a lot of times, obese weight at the time that they come to see me. And I need 100 grams of protein. I'm like, no, you do not. And so, I don't know specifically. The ARIS protocol did specifically mention plant-based, but I think it was much more supplementing with isolates, which I don't think are they increase IGF-1, so not helpful.
Mhm.
Sorry if I can't answer that directly.
No,
We
thank you. I know Dr. Greger's next book is going to be on cancer, so I'm sure he'll cover that. I asked him what he's doing now that the age is out, and that's the key. But no, that's helpful. I know that ARIS protocol is part of it. And Dr. Garth Davis' book too, if you guys have seen Proteinaholic, he has a yeah, he has a great kind of overview. He's a surgeon. He's a bariatric surgeon, and really kind of helps dispel the myth. And I like Dr. Greger's kind of assessment too that every day 50 billion cells die and 50 billion new ones are born, and those proteins from those cells are recycled. So 100 grams a day automatically comes in, and it's exactly the amino acid match that we need because it was made of us.
Yeah.
So you really need, Dr. McDougall talks about only 20 grams a day of additional protein to top that off and deal with waste and turnover. So we're over proteinated, and I'm glad to hear that you would think that even during the operative phase, which does cause some damage during the incisions and such, but it's not like a multi-trauma. It's not like a car accident. It doesn't really need more protein than we've already got. So you think zero point 0.8 is okay?
I mean, I think, well, it depends on what you're eating, because remember, if you're eating a very high fiber plant-based diet, which they won't give you anyways after surgery, but if you are, you might need a little bit extra. If you read Brenda Davis's plant-powered protein book, she explains that because fiber can stop some of the absorption. I don't think that you'd need more than 1.2 grams per kilogram for sure of ideal body weight, but I think 8.8 to 1 is fine. And, we'll find out more with time for sure. Other questions?
Yep, we have one here that was messaged to me. It says, so I have a grandparent, aunts and uncles who had colon cancer. I've had endometrial cancer and breast cancer. I'm striving to full whole food plant-based and exercising along with healthcare. Lets me get scanned every 3 years. Do you think that tracks okay? I'm 55 and I had uterine cancer 11 years ago.
Are
So
you talking about scan for colon cancer?
Yes, she
Okay.
said that.
Every 3 years?
Every 3 years?
Can you repeat the question again? And
Sure. Yeah, I'm just kind of reading it here as it's written. So I have grandparent and aunts and uncles who had colon cancer. I've had endometrial cancer and breast cancer. I'm striving to full whole food plant-based and exercising along with healthcare. Lets me get scanned every 3 years. Do you think that tracks okay? I'm 55 and had uterine cancer 11 years ago.
it depends on what kind of scanning. So if you're going to get a colonoscopy every 3 years, that's plenty and possibly more if there are no abnormal polyps in the first time you get scanned, you get the colonoscopy. I certainly would not do just a fecal occult blood test every 3 years. I would do a little bit more, like a fecal occult blood test and a digital rectal exam every year. You're on a higher, not necessarily on a higher risk, because actually it isn't a first degree relative. So I'm a little less concerned, but I think every 3 years, if you're doing a flex sig or colonography, that, you need to be, I would go more with what the guidelines are right then. But I think if you are whole food plant-based, healthy lifestyle, no alcohol, no smoking, exercising every day, you're taking down your risk factors quite a bit. And there are side effects with cancers. The other thing is, have you done genetic testing? Because that might also, if you've got something where you have genetic propensity for more cancers, then you might want to be more frequent than less frequent. I think is it Laurent syndrome? What is the um, multiple cancer genetics?
There's a link. I don't know if I'm off there. So I did have genetic testing with the breast cancer because that was 4 years after the uterine cancer.
Yep.
Nothing popped. So I was lucky with both, right? But there was some abnormality on a pole, POLE something, but I don't, Lynch did not pop.
That's
Nothing.
Lynch. Good. I'm
Yeah,
glad you don't
the
have
Lynch
Lynch.
syndrome did not pop in the genetics, but it's been a while since I've gone back to see if anything new has been determined, because it has been 6 years since they did the genetic testing, and so, things always come up, right?
Yeah.
So, but it's just I'm very fortunate, I think, with my healthcare that they will allow me to get the colorectal scan every 3 years.
And you're talking which kind of colorectal scan?
The internal,
The
yeah,
colonoscopy.
colonoscopy.
Yeah.
Yes.
Okay.
All right. It's been a couple of years and I've slept since then, right? So, but I mean, the first when they did the first colorectal scan, which was immediately before the endometrial surgery, because I had told them about my grandfather, and then like my dad's sister, and then only a few years ago one of my mom's brothers had it, so it's not all on the same side, so it's great. It's because we knew of this in advance. They did the colorectomy, whatever, before my endometrial cancer surgery, just in case they found something. So they just opened me up once and did what they needed to do. Luckily, they found 3 polyps, but they cut them out. And then the oncologist for the hysterectomy didn't see anything else in there while he was taking out what he took out in my lymph nodes. So anyway, but they did find 3, and then I think in one of the subsequent ones they found like 1 polyp.
Do you know what
So
kind of polyps?
I don't remember.
Okay, because that does make a difference, and they're pretty conservative. If they saw a polyp that was precancerous, there's different kinds. Some are precancerous, some are not. They're pretty conservative, and if they're concerned, they'll repeat it much more rapidly.
Okay.
But the best thing so we do inherit some things from our family, but the biggest thing we inherit from our family is what we eat and our lifestyles. And
right.
So you're changing what you eat and changing your lifestyle. This is great. Like, I got into this because my mom had breast cancer at a young age, and my mom and grandmother were diagnosed. My mom was diagnosed with breast, grandmother diagnosed with colon cancer on the same day, right before I was in medical school. So that was like, aye. And then when I was 47, I realized my mom had breast cancer at 48 years old. And I was like, okay, how do I prevent this? So that's how I got into this. And I used to be scared. I'm now 60. I'm not scared anymore. And that's part of the reason I do this, is because of that family history and that family risk. And, the doctor's saying, no, those are linked. I'm like, great. Good bedside manner the day I'm finding out that both are,
Right.
So, you're reducing your risk every day that you have a healthy lifestyle. So keep doing that. I'm proud of you for that. And that's great.
I've also taken off 70 pounds since my breast cancer. So, I mean, and that's, and whether anybody, I mean, it was a whole journey of Nutrisystem, and I've done Ozempic, but I'm off the Ozempic now. And I did what I needed to do to get down to where I did. And right now I'm actually doing the plant-based certification coaching with Food Revolution for me, right? For me. Hopefully I can be a good coach to me. I'm not sure about the client.
I think you'll be a great coach to the client if you wanted to be, because you have experience and you've tried all these different things.
I'm talking about me as my client, right?
Treat yourself as better than you would treat anybody else.
So yeah, but anyway, I really appreciate the opportunity for this kind of conversation, because it really is hard to do that with, like, doctors in a clinical setting, where whether it's you're just having to get through the procedure and there's just no time, right?
Yeah, it's very tough. Traditional medicine really just puts band-aids on illness. It doesn't go to the root cause, whereas lifestyle medicine goes to the root cause. We go to what's really wrong, change that. Like, I mean, if you're pounding your hand with a hammer, I can give you some Tylenol to help the pain, but that is not getting rid of the cause. Get rid of the cause. Your body wants to heal. And the fact that you've lost the weight, you're eating healthfully, you're doing things that are positive for your own health, have let your body heal. So I'm really proud of you for that. That's great.
Thank you.
It's great.
Very good. Well, I'm not seeing any other questions in the chat here. So before we sign off, are there any other questions? One last chance, one last round.
Just thank you so much, Dr. Scheuer.
Yeah.
You really did it in a way that's understandable and very helpful. I wonder if I took a couple of screenshots. Can I use a couple of your slides in my talk tomorrow if I give you credit?
Absolutely. Absolutely.
Okay.
Yeah, use as much as you want. Definitely.
Okay.
Yeah.
Thank you so much.
Thank you for being here. Your input was very helpful. I really appreciate it. And I appreciate what you do. And thank you all for being here. And Sid, thank you guys for what you do to bring this to people.
Thank you so much.
And just a reminder, the replay of this will be on the PBNSG site in a couple of days. If you want to watch it again, maybe have family members come in and watch it with you. And if you have any questions, you can always reach out to connect@pbnsg.org if you have any questions about the video, or contact me, Sid Nauter, at sidnauter.com. Any final parting words, Dr. Kim, before we say goodnight for real?
Well, given what I'm hearing, take care of yourselves, because if you can take care of yourselves and heal yourselves, then you can heal others too by your example. And we need some positivity in this world. So keep doing what you're doing.
Absolutely. Thank you so much. And thank you everyone for being here. And Dr. Breaky, thank you. Good night, everyone.